A very good evening to you, and thank you so much for speaking to us. So you may have heard parts of that or are aware of the fact that South Africa has expressed its disquiet about the fact that this ban may be too quick and unscientific, most importantly.
Well, thank you very much indeed for having me on. And I did watch all of that briefing, and I think the themes that come out of it are, first of all, full respect for the scientific community here in South Africa who tracked this variant and identified it, and we really commend their transparency. But we are all dealing with this virus together, and we're all trying to track it, we're all trying to contain it, and we all need to act with speed and with precaution, and that is what the British government did yesterday. We totally understand the impact that it has here on families and businesses. We don't want to impose restrictions unless we have to. But what we need to do now is really understand how serious this variant is. And the fact that the WHO met in an emergency meeting today shows that they think this is serious. What we need to do now is work out how we can manage it.
It's interesting that you say that, because the US has taken a rather different approach, saying while it is concerning, it'll adopt a wait-and-see approach, that it doesn't see the need yet to institute a travel ban or restrictions.
So all countries will make their own risk-based assessment, and that is what we did yesterday, it's what others have done today, and it's what lots of countries have done from the beginning of this pandemic, which I fully appreciate has been a long, long period now. But countries will make their own decisions. So we acted in a precautionary way. I think we took the research done by scientific experts here in South Africa who really felt this was a variant of real concern, and that is certainly something that our scientists feel as well. So we need to establish how concerning this is and how best to contain it.
And I'm asking this question because I believe that there is a global portal in which information is, inserted into there, so that you are all appraised of the developments. The South African scientists have been transparent. The WHO has been cognizant of that. So what are you weighing, and is the UK taking this move because it is confident that this variant is not in the UK from the UK?
Well, we certainly haven't detected it in the UK at all. What we have done is pick up, as you say, on the data that is uploaded onto the global site. I think it's called GISD, and it was first uploaded from here in South Africa and I think in Botswana. And that was something we were able to respond to very quickly because of the efficiency and the expertise of scientists down in this part of the world. But now what we need to do is to understand and to dig into that data, understand how significant this mutation is, as a number of the answers from Nicholas Crisp and from Tulio de Oliveira and others on that the briefing just now showed. This is a matter of serious concern. So what we have done is act quickly in a precautionary way to give us time to understand how serious this is.
So, Mr. Phillips, I just also want to understand this in light of what has happened in the past, the commentary around the red list and how it has mostly been seen to target Africa. Do you think that it could disturb what one may call at least decent diplomatic relations with countries by a so-called jumping the gun? Because this is the feeling, as you heard Professor Oliveira there say, that travel bans are not scientifically effective. Could there have been another way while protecting your citizens?
So, I think, first of all, we are not targeting any country or any part of the world. We are targeting the virus and its variants and trying to understand how to deal with it, which is a real-time, hugely complicating challenge. And it relies on global collaboration between our scientific experts in particular, which is why, again, I really would commend our scientific colleagues down here in South Africa for the speed with which they identified it and the transparency with which they shared the data. But as I think Dr. Crisp said, this is about controlling the movement of people. And I know that the WHO has said that they don't feel necessarily that travel restrictions are the best way of doing it, but I don't think they have said that they are not effective. What we are needing to do now is to give ourselves the time to understand how significant this virus is, its transmissibility, the severity of illness, hospitalization, death that it will create, which again, as others on the briefing said, we will not know for a few weeks now. And crucially, what is the impact of this virus on the vaccines that we are all relying on here in South Africa, in the UK, around the world, to deal with the impact of this virus that is still very, very with us in all of our communities.
And I know that, headlines in themselves are very short in detail. But if you take, for instance, the BBC, their headline is Coronavirus Variant Fears Sparks Africa Travel Ban. And what it really is speaking to is a question that I'm asking you, that in the past, for instance, with the Delta variant, the UK then created this red list in which countries like South Africa were on it, and questions were raised about why does it seem that it encapsulates countries, especially in the south, yet their variant is there in the UK and other countries. So I'm asking about the perceptions here, and you're saying you're not targeting that, but how do you allay those fears? You say, Dr. Oliveira said it is not scientifically effective. Well, he did say that. And it's things like that make people question whether or not you weren't too quick in taking such action. Could you not have waited a little bit more to get more information, not only from the WHO, but from other scientists, including your own, or whether or not this is prudent action?
So again, if I may, I'll just go half a step back. As I say, as you said, the virus has gone through various mutations, and we're working our way through the Greek alphabet, and I believe that the WHO is about to say that this one is new. So we've gone through alpha, we've gone through beta, we've gone through delta. All of them have caused sharper spikes in caseload, and of course that is what we are seeing in South Africa through South Africa's own data. It is really not targeted on specific countries. It is targeted on how the virus is mutating, how the virus is developing variants, and whether we can keep up in terms of our vaccine programs, how we can keep up in terms of our public health and safety measures, how we can keep up in terms of our guidance to people about social distancing and masking. We are dealing with this in real time, and it is happening very fast. So when this emerged over the last few days, what the UK did, in large part, as I say, because of the data that we had available to us from scientists down here in South Africa, we moved to take a precautionary measure. Other countries have now done the same today. The WHO has had its own discussions today. We are going to keep a very, very close watching brief on this. We're going to keep talking to our colleagues down here in South Africa and across the world to understand how we can best contain, manage, and mitigate the impact of this virus that is still with all of us.
Mr. Phillips, so you're saying the situation could change in terms of a possible lift of the ban should you realize that it is not quite the danger that you think to your citizens, and also what happens to those of your citizens who are here in South Africa, stuck here, and those who are planning to come to South Africa?
So again, if I may, two things. First of all, we are going to keep this under very, very close review and scrutiny, and we will keep talking to our South African colleagues about what they are seeing and about the risk that we think this poses to all of us. The Prime Minister and the President spoke earlier today and had exactly this conversation. We're going to keep talking to each other. In terms of how things evolve going forward, yes, if we decide that the risk is not so severe as we assess, then as we have done before, when we move countries on and off our red list and the amber list and the green list, then we will be able to make future decisions. But that is what we have to do. We have to look forward, and we have to be able to try and anticipate where the virus is going to go. And that's what we must do together. Logistically,
what can people do? If somebody who was supposed to be on their way to South Africa is then stuck there, and vice versa, somebody who was supposed to travel to the UK who is now unable to do that, is there anything that the UK government will do to assist?
So, sorry, that was the other part of your question. Forgive me, I didn't come to it. What we did yesterday was we said that as of noon in London today, there is a travel ban between the UK and South Africa while we reset up the managed hotel quarantine scheme that will come into effect from Sunday morning. At that point, flights can resume. People going into the UK, if they are Irish or British nationals or have residence to be in the UK, will be able to enter the UK as long as they go into managed hotel quarantine. People leaving the UK, our advice is that you shouldn't travel unless it's essential. But you will be able to, of course, get into South Africa, subject to South Africa's own provisions. If you have the right to go back to the UK, then you'll be able to do that as long as you go into hotel quarantine. But this is a measure designed, as I say, to ensure that we can understand the spread of this variant and understand the impact of it within the UK public healthcare system.
Thank you so much for speaking to us, Anthony Phillipson, UK High Commissioner to South Africa. Very appreciative of your time and sharing with us the real-time information of discussions between the two countries following the UK issuing travelling restrictions for travel to and from South Africa.